Hi there, welcome to debate 2. The question at hand is the organisational response to unhealthy working conditions. And we're going to argue this from position 2, that occupational health interventions should focus on changing work environment characteristics to promote occupational health. And so what is an unhealthy workplace? An unhealthy workplace encompasses both physical and psychosocial factors. Some of those elements of physical factors are occupational hazards, scheduling, working hybrids, excessive noise, temperature extremes, inadequate lighting, poor ventilation. From a psychosocial factor, it's high job demands, low control, lack of social support, effort-reward imbalance, job insecurities. And what we also can see is that there's an interrelationship here where they impact on one another. So what are the outcomes of an unhealthy working place? What we know is that there's an increase of chronic distress, mental distress, physical health problems on our staff, which has an indirect impact on social engagements, both at work and outside of work. Performance issues might start to creep up. People attending work, being present while at work might start to be impacted. And then what we're trying to always avoid is workplace accidents, injuries, and potential deaths. And so how should we address this? We need to be addressing this from the context of changing work environment characteristics. However, with the impact on staff in mind, they both go hand in hand. And so while we're looking at this, we also need to look at maybe some of the sources of some of that distress rather than just looking at the individuals. And so what are the pros of doing this? Some of the pros is it increases economics, increases both physical health and comfort, and reduces stress if we're looking at some of those key environmental factors. Hopefully it increases awareness, increases help seeking skills, especially when we're bringing in key wellbeing programs to help people deal with their own. It also increases safety, reduces accidents when we're doing regular training around safety protocols. It increases performance when people are more engaged, and which allows us to invest in health promotions when we know what our staff want. And then when we're doing all of this, we're aligning ourselves with the occupational safety health regulations, which increases our reputation and credibility in this marketplace. What are the cons? We often hear it's too complex, it's disruptive to the workflow, it requires too much commitment, you're going to have a whole heap of work attitude. How are you going to deal with that? It's going to be too long and too expensive, and you're absolutely right. And so what we're saying here is you still need to invest in it because it's going to improve not just mental and physical in isolation, but together. The average ROI is 138%. It's starting to highlight, key constructs that we can measure, such as presenteeism, absenteeism. Yes, there are methodological issues, and yes, there's some study design issues, but we know that now we can improve it. And overall, there's a consensus that investing in this will increase our economic benefits of workplace health interventions. And so, while my argument is, yes, it is complex, yes, it is long, and because of these reasons, we need to be able to do it, because by avoiding it, what that's going to mean is we're only going to provide a temporary fix, and we're only going to help the well-worried, and we're actually going to ignore the actual group of people that really need that support if we're not looking at what those environmental characteristics are. So by looking at it from an environmental work environment lens, we're catering for 3 domains of worker well-being. We're looking at the well-being of the staff member in the context of work, in their own context-free environment, and also in that transition between work and family, and sometimes the spillage that occurs because of it. And so is it complex? Of course it is. This is why it requires a comprehensive approach. Unfortunately, what we often see are secondary interventions and tertiary interventions that quite often are catered to the individual. It's about getting people to recognize their distresses or stress and being able to respond to it. But as we know, that's short-lived. And yes, we can treat that, but again, are we actually hitting the core root of it? And quite often we're not. And this is where primary interventions are key. And this is where looking at environmental factors or environmental characteristics might actually be helpful for us as an organization to be able to cater to the cause, not just the symptom. And so everyone has a role to play. It does involve multiple stakeholders. It does involve a systematic approach, careful design, implementation, and evaluation process. All of that is required to be able to cater to the complexity, the time factor, the expensiveness of this activity. However, Is there a model that we can use? Absolutely. When you use the article Conducting Organizational Level Occupational Health Interventions by Nelson, Randall, Helton, and Gonzalez, they highlight that there are some phases that came out of 7 dimensions that they identified at a governance level and 5 different occupational health interventions that they extracted this methodology from. So being prepared is really important. Understanding the problem, understanding the intervention that we've all taken on board and agreeing to it. Having a screening phase where we're actually able to assess and ask and get the information that we need to validate our efforts, putting in an action plan so that we have timeframes to be able to achieve what we need to achieve in the segmented times that we're given. What does the implementation phase look like? Who's going to be monitoring that? And then what is the evaluation? And while there's only 5 phases here, there are a lot more in depth, but we also need to involve the employee as a guiding principle in all of this. So to summarize, is it too complex? Yes, it is, but we can overcome that by planning and preparation. Is it too long? Of course, it's going to be long, but with an action plan, we can actually utilize that time wisely and efficiently. Is it expensive? Absolutely, but we see the return on investment is up to 138%. Is it going to require too much commitment? Absolutely, but if we share the role across the board and everybody has a role to play, we're likely to get more involvement and commitment rather than attitude. And then lastly, change is disruptive. However, so it's also beneficial when planned properly. Thank you so much.